Hi, I'm Miguel. I'm a developer at DevLab Mexico. Today I present you one report about the impact of COVID-19 that we made in collaboration with CrossCompute. The main purpose of this report is to inform in a periodic and also in a visual way to journalists and the medical staff about the impact of COVID-19, especially these with persistent diseases. We take the data from the Open Data portal of the Mexico government. We process this data in Jupyter notebooks that are available in the DevLab Mexico organization at Github. Also, we automated the generation of this report in the CrossCompute platform. What is the current situation in Mexico? At this moment, Mexico registered more than 2.1 million positive cases of COVID-19. 222,000 deaths, of which 120,000 were people with persistent disease. In this chart, we see more positive cases with hypertension, obesity, and diabetes. But the deaths impact more to people with chronic renal failure, EPOC, and the cardiovascular disease. In this chart, we see the COVID or the cases of COVID-19 start to increase quickly. The number of infection from the 40 years old, but with one exception, the asthma starts from the 20 years. When we talk about the mortality, we see the same behavior, but now obesity and the asthma start to increase the number of deaths from the 60 years old. Now let's see some statistics of the COVID-19 on each state of Mexico. The data that we see in this section was normalized based on the number of people on each state. The number of people was taken from the last population census made by the INEGI in the 2020. In this chart, we see the states in ascending order of cases. Colima, Baja California Sur, y la Ciudad de México are the states with the major level of infections. In the second chart is ordered by the number of deaths. Also here, Colima has the first place, with a major distance respect to the Mexico City. In this map, we see the last mentioned, and also the states in the north of Mexico were more affected by COVID-19, but with the exception of Chihuahua and Coahuila. In terms of mortality, we see in this map that all states have almost the same level of mortality, with the exception of Chihuahua and Coahuila. Last but not least, we see the impact of COVID-19 in pregnant women. Fortunately, the death rate is lower than 1% of 50,000 cases. This means the COVID-19 doesn't affect pregnant women in a major way. We want thanks to CrossCompute for sponsoring this report, and also to Noé Dominguez and Monica Benitez for the publication and revision of this report.